Hi there, my name is Miles Carter. I'm a GP based in Oxford and I run Ardens for EMIS Web. And the purpose of today's brief presentation is to run through with you how Ardens can help practices comply with the 2020 GP contract requirements, the network DES, and use EMIS Web to its full potential to achieve that. Now, I've only got 15 minutes, so I'm going to run through this quite quickly, but should you wish to receive more information after the presentation, then there'll be a slide at the end of this which explains how to get hold of that. Let's start by just running through what is new for this year, both for the 2020 GP contracts and also the network DES. Now, for those of you who are not fully up to date with the latest NHS England bulletins, they have stated about 10 days ago that QOF for this year is going to change quite significantly, but they've not said exactly what is going to change. What I suspect will happen is that the requirements will be reduced and many of the reviews won't be needed, at least not to the same level of detail, but we're waiting on further guidance from that. So I'm going to cover here what is in the contracts. There's only 3 or 4 points which I think might change, and I'll cover those now. So asthma, COPD and heart failure have all changed this year. There's new requirements for diagnosing asthma and completing the review, and the same applies to COPD, and there's now a more detailed review required for heart failure. These are the 3 areas that I suspect might have a reduced review requirement, but like I said, it's not been confirmed yet. Now, non-diabetic hypoglycemia is a new QOF indicator, and you're expected to be doing annual HbA1c blood tests to people who are known to have this. And we have a solution to help you with that, which I'll come on to later on. And there's also a requirement to do a postnatal check for new mothers. This is now GMS contract work. It's not QOF work, and I suspect this will not change and it will remain in the contracts. And it's important your practices understand those requirements and what is expected so that you can complete that work. Now, there's 2 new quality improvement domains, and these are not changing with the COVID updates. So there's the learning disability quality improvement domain, and there's the early cancer diagnosis domain. Now, it's important you understand what you're expected to do for this, because you will be expected to do it, and I'll cover that within what Ardens can offer you later on in this presentation. For learning disabilities, you're expected to improve the identification of people and also increase the uptake of annual health checks. These are quite long, complex health checks, but they are paid at an appropriate level to complete that work. And early cancer diagnosis is really expecting practices and primary care networks to work together to improve participation in the national cancer screening programs and also ensure that patients with suspected cancer or cancer symptoms are being referred appropriately and monitored appropriately. Now, moving on to the network DES, there are 4 main areas to focus on during today's presentation. One is enhanced health in care homes. So practices and networks are expected to, again, work to standardise how they're managing patients in care homes to ensure they're having regular weekly ward rounds, which can be done remotely or in person, and also update and record the patient's condition. Clearly, when a patient needs to be seen in person, that needs to happen, but there's no reason why you cannot do the ward rounds remotely via an audio or visual consultation where appropriate during COVID. And don't forget, the comprehensive geriatric assessment should be completed for most patients where possible. Structured medication review should also be carried out by your PCN pharmacist or any other qualified clinician who can do that. And we've got resources for you to help you ensure that you're standardising how you're working. And we've discussed early cancer diagnosis already. The point is also in the network contract because NHS England is expecting networks to work together to achieve those requirements. And also, of course, networks are expected to recruit additional roles such as social prescribers, clinical pharmacists or physiotherapists, etc. And we've got resources to help those clinicians standardise how they're recording data across your member practices to ensure that everyone's doing the same thing in each of your practices. Now, what I'm going to do now is jump into EMIS Web and just run through how Ardens can help you achieve this. But before I begin, it's worth, I guess, understanding what Ardens is and how it works. So Ardens is a clinical decision support and workflow optimization solutions running at about 2,700 GP practices in both EMIS and System 1, covering about 26 million patients. And what we're trying to do really is a number of things. We can offer you smart templates to help you standardise how you're recording data in your consultations, both at practice and network, and also at CCG level. We include real-time data quality alerts to ensure that any coding errors made by your clinicians and other practice staff are corrected at the point that they're made. It also includes MHRA clinical safety alerts to ensure that practices are following clinical safety guidance, and we update those for you throughout the year as the guidance changes. It includes a very powerful patient recall systems, both for ad hoc reviews such as blood tests, hospital tests, ECGs and X-rays, but also chronic disease annual reviews based on month of birth recall. And we've got smart templates which will allow you to complete the entire review using just one or two templates should you wish to do that. We integrate your locally commissioned services requirements so that whichever template you're using from Ardens, then where there's a local contract requirement, we include those locally required codes and a separate reporting module to ensure that you're submitting claims correctly. And there's also a powerful searches and reporting module within Ardens to help you ensure you're following national safety guidelines, NICE guidance, and also the relevant contract requirements like CQRS reports, PPA reports, and other similar reports. There's no time in today's presentation to cover all of this, so I'm just going to focus on the network DES and GP contract today. But at the end of the presentation, there'll be a separate link to a webinar you can watch, which covers how the entire Ardens system works in your practice. Let's move into EMIS Web. What you're looking at here is our COPD templates. Now, I'm showing you this because it's important to understand that the Ardens templates work in a different way from the EMIS templates, but they run alongside the EMIS templates inside EMIS Web. In other words, EMIS will run at the same speed it normally runs at, and there's no learning required to use our system because it looks exactly the same as what you're used to in EMIS already. So let's say you've got a practice nurse wanting to do a COPD annual review, including the new contract requirements for that. So you launch our COPD template, and down the left-hand side are a large number of pages. Now, you're not expected to use all of these pages in that review. This is more like a mini textbook of medicine. On the left-hand side of is the index or the contents page. So if you're a GP, for example, seeing this patient, you might want to press the cough button to complete the cough review. Any text in red indicates it's contract work. It makes it very clear. And as you can see here, here's your MRC dyspnea scale. It tells you how to record that using the correct clinical code. And also, don't forget to record the number of exacerbations in the past year. Let's say it's 3. That's in this financial year's requirements. Now, if you're a practice nurse, there's much more to do than just this for a COPD review. And a nurse might say to you, why would you just record this and that review? They would skip that page completely, and they would use the 3 review pages here: control, lifestyle, and other. And this combines all the QOF requirements in red with NICE guidance in black. So it's really important to understand the differences. So nurses know what they must record for payment, but what also is optional if they've got time to do a high quality review. Things like CAT score, miscellaneous questions, etc. Lifestyle is things like smoking and obesity. Other is things like osteoporosis risk assessment, depression and anxiety assessment, blood pressure, and also fitness to fly with links there to the guidelines. And that's it. That's your review completed. Save your template and move on to the next patient. But our templates are much more than just about reviews. Let's say you've got a clinician, a less experienced clinician, seeing a patient who has got a chronic cough and they're a smoker, but they're not quite sure how to diagnose COPD. Well, this button here will tell them how to diagnose COPD based on the latest NICE guidelines, including red flags and also differential diagnosis. Similarly, this button here will tell you how you might diagnose an exacerbation of COPD, again based on latest NICE guidelines. Remember, the future of primary care is not just experienced GPs seeing patients, it's a whole range of clinicians, pharmacists, paramedics, etc. You've got vaccinations, flu and pneumococcal, management guidelines, and also referral advice. When to refer to the respiratory team or pulmonary rehabilitation, again based on latest NICE guidelines. Patient resources, things like British Lung Foundation patient passport, inhaler technique videos, and COPD self-management plans. So we've updated all of our chronic disease templates to align with the latest GP contract requirements. And should they change in the next month or two, once NHS England publishes the latest guidance, we'll update the templates again to ensure that whenever you're using one of our templates, they follow those guidelines. Let's look at the postnatal mother check, for example. That's a new GMS contract requirement. It will remain for this year, we're pretty sure, and it's important your practice staff or practice clinicians know how to properly complete that examination based on national guidelines. And again, here's our postnatal mother examination template, and down the left-hand side it goes through how you might complete that examination based on the relevant guidelines here. Again, there's no time to go through this in detail, but you can get the idea of what we're doing here and the fact it covers off the entire review quickly and easily using correct clinical code. So what that means is you can run reports at practice or at network level to ensure you're complying with those requirements and also comparing activity should you wish to do that. Gestational diabetes is really important because that's one thing that's been picked up on in the GMS contract. It's reminding you here what you're supposed to do, including your HbA1c interpretation during pregnancy, something I often forget myself. Moving on to the network, Des, you've got enhanced health in care homes. So our care homes templates will make it really easy to complete that care home review. It's got things like administration for patients. That's how you record the residential status, living in a care home, a nursing home, or moving back to their own home. Is it respite care or intermediate care? You've got a baseline and initial assessment, which lets you quickly and accurately record how the patient usually is and update it with drop downs here. I find that very helpful in my own practice, and it goes through the entire comprehensive geriatric assessment there. You've got the acute visit or ward round page to record when you do a ward round or an acute visit to the patient, dementia assessment, frailty assessment, care planning, which allows you to record an accurate care plan, which automatically uploads to the summary care records. Really helpful. And then medication review and vaccinations. The structured medication review, again, that's an important area, and this template is freely available to any practice to use, I should add, by downloading it from the Ardens portal, as is our care homes template, by the way. And what this template will allow you to do is record a comprehensive medication review, and you can standardise how you're doing that across your network really easily. So if you've got a PCN pharmacist, they can work across your practice using the same template, recording the same data to ensure that that review is completed, including things like polypharmacy checks, follow-up, multi-compartment aid assessments, and of course stopping medication for people with a learning disability where it's inappropriate. So this is how you can standardise how you're working in your practices. Now, cancer safety netting is a new area. So the Ardens cancer safety netting template will help you achieve three things. It will help you to track 2-week rate referrals to ensure patients are actually seen in clinic. It will allow you to track diagnostics. So if you're referring a patient for a CT scan or an MRI scan, then it will track whether that patient has been seen in the clinic by simply ticking one box here, and then the follow-up system works in the background automatically to alert your reception team or administration team that have not been seen, and also alert clinicians. Similarly with the referral tracking, if the patient is not seen in a 2-week rate clinic, then it will alert you within, I think, after 14 or 21 days that patient has not been seen yet in clinic, so you can chase that up. And similarly, with symptom safety netting, you can safety net symptoms that might be suspicious of cancer but have not yet been diagnosed. So, for example, a patient who's in their 50s presenting with dyspepsia, who you might want to put on a PPI for 1 month to check it's going to improve. You can easily track that by selecting the symptom here. So let's say dyspepsia, which is here somewhere. There we go, and you want to follow up in 6 weeks' time, 6W. That automatically puts them into our safety netting system, and they will then be tracked. And then, if that patient does not represent within the 6 weeks, then we will be alerted by our pop-up alert and also a separate report for your administration team to bring them back in for that follow-up appointment. So that, again, allows you to standardise how you're managing your potential cancer patients across your network, should you wish to. So for more information about Ardens, then I recommend you watch the Ardens Introduction pre-recorded webinar. It's 40 minutes long, but it does cover the entire functionality within Ardens for EMIS Web, and we recommend you watch that before deciding on whether it's something you'd like to use in your practice. Now, the Ardens EMIS Facebook group is a good area to ask questions about Ardens. The Ardens portal is where you can access our free resources. So our care homes template and the structured medication review template, for example, are both available for free download from the Ardens portal. So please just visit that if you'd like to just test out those two templates or share them with your primary care network to standardise how you're recording those two parts of the review. And of course, for subscribers, the portal offers much more functionality in terms of accessing our searches and reports and other updates as we release them, when you don't want to wait for us to update your practice for you automatically. And any practice wanting to request a free 3-month free trial of Ardens, please visit ardens.live/trial and complete your details, and you can activate a 3-month free trial of all of our resources, which might help you decide on whether this is something you'd like to use before purchasing it, either as a practice or network. If you've got any questions, please email me at miles@ardens.org.uk. Thank you very much.